Okay, guys, so back again. Hello again. There was some confusion between me and my guest. So, oh, thank you so much again. She already sent me a request. My guest is here, so please welcome my guest, Mrs. Meera Raina. She'll herself introduce you.
Hello.
Hi. Okay, am I
Hi,
audible?
hey. Yes.
Yeah.
Am I?
Yeah. Okay, so guys, meet Mrs. Raina, and her Insta name says it all: infertility to motherhood. We would love to hear everything from you. I don't think I have to say anything about you because your name itself says infertility to motherhood. That means you might have struggled a lot for getting this motherhood feeling. So, Meera, you want to introduce yourself to everyone?
Uh, sure. Okay. Can we just wait for some more people to join?
Yeah. If they don't join also, we'll save this live on my IGTV. You can share it later on too. So not an
All
issue.
right. All right. Hi, everybody. This is Meera, and as my page name says, I am blogging my journey from infertility to motherhood, and I've been trying to conceive for almost 7 years, and I've tried everything that there is in the protocols of these doctors. I've tried follicular monitoring, I've tried IUI, I also got my tubes tested. Then finally, I got IVF done, and luckily enough, it was successful in the first cycle. And this is when I decided that because when I was going through all that, I was not aware of what IVF is, what how big a deal this is. So had I known it, I would not have delayed it so far. Not I wouldn't have waited 7 years, obviously. So that's why I'm vlogging my journey, and I too have connects on my page with doctors for specific infertility issues, and the resolution is basically is artificial reproductive techniques only. But yeah, I do have these connects.
And there's this the content award, something like that in your blog.
Yes.
Please
Oh,
tell us
how
about
could
that.
I forget that? So
Yeah.
this happened last year, and I was not even sure that even I would be shortlisted or not. I just registered myself, and from the picture itself, you can guess that I was not sure I'll get the award. So I just registered myself, and it came as a surprise that I saw some other blogger shared in her status that she was shortlisted in the same category where I had registered myself too. So I thought, let us check who all are. I was still not sure that I will be shortlisted. So I just wanted to check who all got shortlisted. So I saw my name there, so it came as a surprise. And then I thought, okay, shortlisting, and that's this far will be the end of journey for me. And then luckily enough, I got a call from them saying that you have won and all. So that was
So
huge.
what was this award all about?
So basically, She the People is a platform that basically is very feminist. They are feminist. They all are very feminist, and they're working for empowering women from around the basically, yeah, around the globe, I guess. And this award that I was given was for my page where I blog about the issues, and yes, basically towards my efforts for normalizing infertility. So my award was for
This
that.
is
It
this
they
is
had different, yeah.
it takes really, you're very strong who's coming forward and speaking on these topics. These are some topics, these are some sensitive topics for every lady because they don't know about these things, and they're like, okay, ye kar lete hain, and as you said ki itna delay and all. So it's very good to talk on this and write on these things. And I was searching for someone who comes live with me and talk on this topic. I just wrote infertility, and I got your page. So keeping your name, your Insta page name as infertility to motherhood, it takes a lot of courage, I think. So it's huge. Whatever you're doing is very good. It's great. So you
Thank
want to
you.
tell us about your journey of motherhood?
Yeah, as I
All
said
all
earlier,
the
so
struggles you have faced and everything we want to know.
okay, so yeah. So when we decided now that we want to settle down, we want to start a family. So we were pretty young. I mean, 20, I was 28, my husband 30. So we were like pretty young couple and we decided we want to have a family. Didn't happen. We tried for like 2 years. Then we started visiting doctors and then we did follicular monitoring for like 2 years. And then we took a break because of some personal issues in my family. So we took a break. We couldn't concentrate there because follicular monitoring is very draining. You have to go for scans every alternate day. Then if there's a problem, I had a problem that my eggs were not releasing, so I had to take an injection. So you have to take an injection, and then the follicle releases in your uterus, and then sorry, in your ovary. Then the doctor tells you to go now try. And so this was a very draining journey, and we did this for 2 years. Then we took a break, and then we tried it again for a year. And then I thought now this is enough. And we changed like 3 4 hospitals, and I even went to AIMS where we used to spend just for 15 minutes counseling with the doctor. I used to spend all day there because AIMS is the busiest hospital in Delhi. So I even
Yeah.
went there. And uh, and uh, before going to AIMS, I was already prescribed when my IUIs also were failed. So I was always suggested that now you should go for IVF because everything is okay with you, and I don't know why it's not happening when IUI has not happened with you. So let's go for IVF next cycle. But since at that time I was not very aware what IVF is and how invasive is it, and uh, basically I didn't know anything about IVF. All I knew was that it's a big invasive technique, and I was not ready for it mentally. So I thought let's take a second opinion. So then again I visited a different doctor. She said, okay, now you have already spent 4 years. You have already spent, and you have done everything. Give 1 year also. Give 1 year to me also. I'll also try with follicular monitoring. Then again, that was a very exhausting journey. The follicular monitoring among all this all entire among my entire journey, this follicular monitoring was the most training one. And then that also didn't happen. Then I decided now I'll go to AIMS. I don't trust anybody now. Now I want to go to AIMS. And there it was so exhausting. I used to reach there by 8 just to get my number, my parcha
You
earlier so that
you
I'll
are
be called
basically
earlier.
from Delhi only. You are settled
Yes,
in
yes,
Delhi. Okay,
yes,
okay.
I'm from
So
Delhi. So just to submit my parcha earlier than all others, I used to reach there at 8 and then used to spend all day there, and the doctor would come and say. But then I just happened to ask doctor because she also started the doctor there also started with basic tests, what hormonal tests and everything with me. Then I just happened to ask her one day, what about IVF? Can we not go for IVF directly? Then she said, if you can afford IVF, then you should go for IVF. If because this is AIMS, we have to start. This being a government hospital, we have to start from whatever the protocols are written for us. So you'll again waste a lot of time there. One cycle you do some tests, another cycle you do some tests, and IVF costs is same here also. AIMS also charges what IVF is costed elsewhere. So that's when it occurred to me कि ठीक है अभी तो I have to go to IVF only, so let us look for some good IVF centers. Then there was this known gynae in somebody's known, so that's how I met her. She told described the whole process. Then I was already mentally this IVF done, and maximum I had already planned that 3 cycles I'll do, and then it's enough. उसके बाद I'll just stop everything. अब उसके पीछे I don't want to be always planning for a baby, so I'll just stop after 3 cycles because it's very exhausting. And at the end you go through that entire cycle, then you do the test, and the test is negative. It takes a lot
mentally
out of you.
get mentally
So
harassed.
हाँ, so that's when I decided 3 cycles I'll do. That's it. उसके बाद I'll not do anything. Then we'll do something else. We'll plan
Okay.
something else. We'll plan a lifestyle free. So we'll spend our energies and money into something else. So that's how. But luckily enough, the cycle was successful, and I can't thank stars
First,
enough
first
for
IVF
having.
was successful.
Yes, first time, yes, was successful, Maria.
Okay, that's great. Luckily. So, what do you want to say? How mentally, what happened to you, like financially, how many losses you went through this journey, and what about your mental? ऐसा कभी था like you said कि नहीं अब मुझसे नहीं होगा. I want to quit. I don't want to do anything. So they might
I was
have.
on the verge of quitting. Actually, I was on the verge of quitting when I decided now I want to do IVF. Okay, basically it
Because
was
it's a
follicular
long
monitoring,
journey, 7
and
years.
then IVF. I'm sorry.
Yeah. Because it's a long journey, 7 years. So like
हाँ
कभी भी your
हाँ
mood can be
so
like no,
the
don't go
third
बस.
stage was IVF. हाँ
Yeah.
थर्ड स्टेज ऑफ IVF. उसके बाद they would have suggested surrogacy adoption या donor eggs या कुछ भी they would have suggested, but mentally I had planned that this IVF, 3 cycles of IVF, if it doesn't happen in 3 cycles, I'll stop every effort. I'll put end to this. I don't want baby then. So this is how my mental condition was when I said, okay, now I'll go for IVF, and I had already planned no more than 3 cycles.
Okay,
And
okay.
financially also, I lost count actually, but I remember there was one test before IUI, one test and one set of tests, which costed, they just took 2 vials of blood, and it costed me some 15,000. So that's in big, the huge amount I gave for tests. And that
Yeah,
follicular
just
monitoring that happens scans every alternate day. So it's packaged. So what actually these centers do, radiation centers do, if you are doing one scan at a time, because you're not sure how many scans you will require. So if you're doing one scan at a time, so it's 500 rupees per scan. But if you want the package until your doctor says now you're ready, now your eggs are ready, so that is 1500. So I did for like 3 years. So every month I used to go and give 1500 to my radiation center. Okay, check how my follicles are behaving. And I remember at that time I was living in Ghaziabad and working in Gurgaon. Same with my husband. We were living in Ghaziabad. He was working in Delhi. So usually I used to take leaves for those 5 7 days and get myself tested here nearby. But one time, what happened? The leaves were not possible. So I thought, okay, let's do one test here, one test there, one test there. So that was even more exhausting. I did one test near my office, one test on the way, one test near my house.
okay, okay.
So that's when I put end to the follicular monitoring. That's
But
no,
you
now it's
didn't feel,
not
even
anymore my
that time you
company.
didn't feel like नहीं नहीं अब नहीं करना है बस stop it. You felt
हाँ
it like
फॉलिकल मॉनिटरिंग वहां पे आई स्टार्टेड कि अब नहीं करना है, लेट्स गो टू एम्स नाउ. अब बस एम्स के डॉक्टर ही करेंगे जो करेंगे.
okay, okay.
दैट्स
So,
व्हेन आई डिसाइडेड
what
आई
do
गो
you
टू
want
एम्स.
to say about infertility? There are many people who go through these things, like infertility. Even after having one child, they are
हाँ
like
हाँ
eager to
दैट.
have the other child. So, are there chances of infertility after having one baby too?
Yes, sure. There are. That is called secondary infertility. What I had was primary infertility, and what
Okay.
you are describing is secondary infertility. And the causes behind that secondary infertility is again because age, age factor of the
सबसे
mom,
पहले that
and
is
उसके बाद
obvious.
eggs का quality, lifestyle change हो जाता है. So that is quite possible. There's no surprise there.
So, so what do you want to say to those people who go through infertility thing? Do they, do they spend, should they spend money and time doing all the tests, or they should go directly to IVF? And how much time
So.
should they wait?
Okay. So even your doctors would suggest, so try for like 2 years or maybe depending on your age. So if
Okay,
you're not more than 35 years old, so then you can try first to conceive naturally. If it's not happening, then you should go talk to the doctor, because even before IVF, there are some techniques that can help you conceive. Like I said, IUI or follicular monitoring could also help. So you should not. You should take your doctor's
suggestion.
suggestion in consideration before deciding on to go for IVF, because you may not require IVF at all. And IVF is, as compared to other procedures, it's a costly procedure.
Yeah, okay. It's a costly procedure, but what do you want to say about the advantages of, or you what is happening with your baby? Is your child safe and secure, and any
Ah,
like
that is one
you,
of the myths. I actually
yeah,
yesterday
yeah.
uploaded.
Actually, everyone has got this issue कि infertility के बाद पता नहीं मेरा baby normal होगा or abnormal होगा. There's this query I have came across.
I think if you're doing it with IVF, because you are involved in every stage. When my baby was an egg, when my baby became an embryo, when he became a blastocyst, you're aware of each and every stage of your baby, which doesn't normally happen in normal pregnancy. But I'm not degrading normal pregnancy in any way. But
Yeah.
it's not that babies through IVF are not abnormal at all. And I actually uploaded a reel yesterday, busting all the myths that people have with IVF. So no, babies through IVF are not at all abnormal. They are just like, if I show you my baby, you won't be able to guess that it's an IVF baby or a normal baby.
Yeah, I have been seeing through your post. Okay, what
Yes.
is IVF? What is the methodology behind IVF?
Sure. So what happens in IVF is, first, for women, what happens first, they'll test both of the partners who want to go through IVF, and they'll test the sperm, they'll test the egg, they'll test any historical genetic condition that might come into your baby. All that is fine. They'll start they'll call the women on the second day of a cycle, and then they start giving hormonal injections to, I don't remember the hormone name, but the injections are for, basically every cycle we produce one egg. So those injections are for producing multiple eggs because they want to retrieve them all. So
Mm-hmm.
they'll start giving injections every maybe for 15 days. They'll call you to the clinic, or maybe you can yourself take those shots. I've seen women taking those shots themselves too, but I was going to the center. So they inject, that shot is on your stomach, and for 15 days they do not, and they keep scanning to how many follicles are there, if they need to increase the dose, everything they scan. And if they are fine with the number of eggs and quality of eggs, then they will give you a trigger shot. And that is the trigger shot is when they'll give you a trigger shot, and they'll also give you a time, and you have to take that shot exactly at that time. What happens after that shot, after 3 days, your egg releases from the follicle. So that's when they'll call you for egg retrieval. So
Okay,
if they have
okay.
said that take it at 10:15, you have to take it at 10:15, and according to that, they'll give you another date, that come to the center at this time, this day,
Exactly.
basically
Okay.
3 days. After 3 days at this time, and that's when your retrieval will be scheduled. So
Okay.
okay, so this part done, trigger shot is done, and then after 3 days you visit their center, and then the egg retrieval takes place. They in egg retrieval, they you are unconscious, you're given sedatives, and they retrieve the eggs, and you are not told how many eggs they retrieve, but if you ask, they might tell you. But that's when they retrieve your eggs, and then you are sent off. After that, I was suggested by my doctor to take a break, take a cycle's break, because a lot of things are happening to your body. Your body is going through so many hormonal changes. So he said, let your body come back to its natural cycle, then we'll start the transfer of embryos. Meanwhile, what they do, they take your partner's sperm and fertilize your egg, and they let it multiply till blastocyst stage. That is day 5. After day
Okay.
5, they freeze your blastocyst.
Okay.
And then my blastocysts were kept for us for 1 month, and then I was called again for transfer, egg transfer, and blastocyst transfer basically. And blastocyst transfer mein they don't seduce you, sorry, they don't give you sedatives. You're not unconscious, and they even show you, this is what we have transferred, this is your baby, this is your potential baby. So they
I got
transfer
it.
two
So
blastocysts to
you
me.
see everything with your eye. My God. Okay.
Yes. So they transferred two blastocysts for me, and one of them couldn't mature into the sac. Next stage is the sac. So one of them matured into the sac, and I obviously was a little disheartened. I wanted, since it's happening after 7 years, let it be two at a time. But then my doctor suggested that, as a doctor, we are more elated when it's not multiple pregnancy, because the chances of failure and miscarriages are a lot there. single
Okay.
pregnancy is they are more
Strong.
inclined towards if their patient do not get multiple pregnancies.
Okay.
So yeah, that was my journey.
Okay. And after that, you can feel that motherhood which you were waiting for, right?
No, not till 3 months. I was so skeptical. Every test, because a lot of tests they suggest in first trimester. Every test, I used to think something is gonna go bad. Something is gonna go bad. So after my first trimester passed, then I was like, I sighed a sigh of relief. Okay, now, okay, no,
Yeah.
now then I could see that I could visualize that I will become a mother in some time, because until then I was like waiting for something bad to happen. I was so skeptical about all that. First
I know
trimester was
that is so obvious after
very mentally
6
torturing for
years of
me.
negativity. That feeling is obvious from a
I'll
human.
tell you one more thing. When I tested, because when the egg transfer happened, they said after 15 days you can test. Huh? After 15 days you can do your home pregnancy test. I did. I found the second line also. I didn't believe that. This is a false negative. This is a false positive. Let's go for the blood test too. After the blood report came back, only then I was sure. Okay, now I'm pregnant, because I had seen like hundreds of negative tests. I couldn't finally believe my eyes when I found one positive test.
That's positive. Oh my God. Okay, so this can bring tears to so many eyes, I guess, this story. So, what about, can you say about that feeling? I know feelings are not expressed in words, but what about feelings of your parents, of your family? When did you tell these things to your parents? And what about
So
they
we,
accept this IVF thing? Everyone in your family or anyone
uh, I have been lucky in that matter. Everybody is well educated, and they're not like very orthodox in that manner. So so I've been lucky in that aspect. So they knew we're going to IVF, and we had to tell them right away, because with us they too were waiting for when will this happen to us. So we told them right away. As soon as our blood work came back, we called both set of parents and told them that now finally.
You didn't get to hear this from your friends or from anyone कि ये क्या कर रहे हो, this is bakwas thing. You didn't get to hear these nonsense things, right?
No, 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 no. Not at all. In fact, they were also concerned, and even a few of my friends even told me now, those who were close to me, obviously, only those who can talk in that space,
Yeah.
suggested that you should go for IVF and all. But yeah, I myself was not mentally prepared for IVF.
So were you like this, like if people used to come and suggest कि IVF कर लो and you were like कि ये क्या बकवास कर रहे हो? Have you ever gave this reaction in your mind, even in your mind?
The IVF Carlos Pito, I didn't have any such. I never got offended because of that. But yeah, whenever I used to get a new Babaji, that used to blow my mind off.
Okay.
Babaji and Totke, I was like, okay, one at a time. Let me do one Totka at a time, because I'll never know which Totka works for me. So I can't do several at a time. So I'll do one Totka at a time.
Okay. So how many did you do? And which was the most
None,
specific one
none,
you?
none. I didn't none. Even
Okay.
at the center, I just to shut some people, I used to say, okay, I'll do one at a time. Bring next another time. And even at the center where I was going to underwear, there were a lot of couples I met, a lot of women basically I met who were in the same condition. Those who decide to go for IVF have been trying for a baby for a very long time. So I met a lot of people who were doing all those things. I even told them that you are paying so much amount here. You're hugely paying here. It is trust them. Why are you wasting your money if you don't trust them? Do that thing. One more, one funny incident also happened when they did the egg transfer. They told me after 5, don't go to loo, because you have to build pressure. So you are obviously on the verge of peeing. So they told me after the egg transfer, don't go to loo for 5 minutes. After 5 minutes, it's safe to go. So I wanted to go to loo after 5 minutes. There was this lady, and she had been also trying for IVF for very. She was been trying. She had been trying for, I think, maybe uh, for more than time, for more time than me. She was even more aged than me. She told me not to go, because it may fail. Doctors तो बोल देते हैं नहीं. फिर मैंने उनसे पूछा क्यों, तो once she had done this from some other center, and they had told them to stay there for half an hour at least. Menka, that didn't happen now with you. That is why you are here. Now they're saying after 5 minutes you can go, so I'll go. I had to pee. I went and peed, but she stayed for 30 minutes. I don't know what happened with her after that, but that was
Basically,
also funny.
you this all infertility and motherhood thing. एक कान से सुनो and filter it, then एक कान से निकालो. We should do this.
That same woman told me she had also done, because she was more aged than me. She has even done IVF like with some older techniques. So there was one technique in which all the women were kept at the center only for 15 days. Until after I transfer for 15 days, they were kept in the center only on complete bed rest. They were not allowed to go to anywhere except for loo and all. So that also she had gone through.
And that also failed, in fact, for her.
That also failed, yes. So bed rest, so this
It
center told me no bed
depends
rest at
on
all.
people to
Just
people,
don't do.
person's body. It doesn't depend on like these myths, right?
No, bed rest is not required because of IVF. Even in natural pregnancy, sometimes bed rest is required, but not because of IVF. You are recommended bed rest. If there is something else wrong with you, you might be suggested that you should do bed rest. But these IVF people tell you should not at all get stagnant at one place. Keep doing what you were doing. Just don't do very harsh things like don't walk up the stairs. Don't wear heels. Don't wear heels because you might fall down.
Okay. And like pushing things or pulling heavy things.
Pushing, weighing, lifting heavy things, ये सब चीजें they told not to do. But bed rest they didn't say. They explicitly said no to bed rest, because this is a very firm belief in some people that we have to do bed rest if you are going through IVF. No, it's not true.
What about surrogacy and IVF? How do you define surrogacy and how do you define IVF?
Oh, okay. So surrogacy can be achieved through IVF only. Surrogacy is something when women cannot carry her own baby. So in that case, they lend a uterus, they lend a womb from some other mother. So that's called a surrogate mother. That's called a surrogate partner, I think. That's called a surrogate mother, I think. Yeah, that's called a surrogate mother. They lend her womb, and egg is taken from the mother, the couple, the mom from the couple, and the sperm is taken from the dad from the couple. And after it fertilizes, what happened? Embryo transfer happened in my body. In my case, where we were not going for surrogacy. In surrogacy, the embryo transfer will happen in some other woman's body.
Okay,
and then she'll carry the child for the couple. And
this is, surrogacy is to be opted when your body cannot hold, your uterus cannot hold these.
Surrogacy is recommended for those where women's body, कई बार क्या होता है कि यूट्रस ही निकाल दिया होता है women का सिस्ट की वजह से, किसी वजह से, तो उस केस में भी women cannot, wherever women cannot carry her own child, and otherwise her eggs and everything are fine, she can opt for surrogacy. Even gays can opt for surrogacy. या if कोई widower है, he can opt for surrogacy. Surrogacy के there are a lot many laws. I have one IGTV on that too, where one surrogacy specialist has described all the basic laws and all the counseling that happens for the couple and the surrogate. So anybody interested can check that video.
Okay. So basically, all our queries are clear. But you want to say something about IVF myths? Like there are many people who thinks कि नहीं जाना चाहिए IVF में. Like even they are so educated, but they think नहीं है, IVF is not a good thing. What do you want to tell those type of people? And there are many people in my friend list. There are many people who's going to see this, जो infertility जा रहे हैं, infertility feel कर रहे हैं. They go, stressful हो जाता है उन लोगों के लिए, and they are like, no, I want to quit. So what do you want to tell to them?
So I'll tell you something that one of the doctors I met said. One of the doctors I met on my IGTV, she said the key to a successful IVF is persistence, perseverance, and patience. So keep trying; it will happen for you. This is something every doctor has told to me. If it won't happen one way, it will happen some other way. If your eggs are not working, you can work with donor eggs. If your sperm is not working, you can work with donor sperm. So there are a lot many techniques, and at this time and era, there is no chance that you will be childless. A lot science has progressed so far. If you want, you can become a parent. So patience, perseverance, and I forgot patience, perseverance, and one more thing. You have to follow. You have to keep following that, and that's the key to success.
Okay, okay. And do you want to share anything, any part of your like spending something, some moment with your husband, some moment with your baby, कुछ ऐसा which is related to IVF and which is related to your motherhood, which is very specific about your motherhood.
No, IVF motherhood is no different than what
Okay.
normal motherhood. So there's no difference I feel is specifically for me. But yeah, the first trimester I was very skeptical, and not because of IVF. It was because of all that trauma that I had, all those negative. So that
Just yes,
left
all these
left an
negativity.
imprint, but nothing about IVF.
Okay. Thank you so much for your time. Thank you for giving time and talking on such a sensitive topic. So, do you want to answer? I don't want to get it disconnected. Okay. I thought if it gets disconnected at this moment, this would be such a loss. Okay, so do you want to say anything to your viewers? Okay, so one thing I want to say to our audience: please share this with your with everyone. In fact, with everyone, with anyone who wants to know about this. And if you have any query related to infertility and related to IVF, you can go and DM Mrs. Meera Raina. She is such a wonderful woman. She is going to respond to your queries for sure. And do you want to say anything
Sure.
to that?
I do receive DMs because I understand people want to be anonymous, don't want to come public with that, and I do respect their decision. So if you have any queries, DM me. If I won't be able to help you, I have made some wonderful doctors friends, so I can get your queries answered from them. So
Oh,
don't
you have
hesitate.
a
If you have anything to ask, you can.
thank you so much. Thank you so much for your time. Thank you for being here. Thank you for topic on such a huge topic, such a sensitive topic. And I just want to do hats off to you for struggling and not losing hope. And that is the three P's thing work for you. I can say that.
Sure. Thank you. Thank you so much. Thanks for having me. It was so nice
Thank you.
talking to
Bye.
you.
Stay safe.